Good morning. This is Dr. Rajesh Yadav, PhD from All India Institute of Medical Science, New Delhi, and working as an assistant professor and head dialysis technology program in the School of Allied Health Science, Sharda University, Greater Noida. Today we will speak about the topic electrocardiography. So we will discuss about the ECG graph, electrocardiogram, heart arrhythmia, myocardial infarction, and ECG in the heart attack. So what is the electrocardiography? Electrocardiography or ECG is the process of recording the electrical activity of the heart over the period of the time using electrodes placed over the skin. These electrodes detect the tiny electrical changes on the skin that rise from the heart muscles electrophysiologic pattern of depolarizing and repolarizing during each heartbeat. The overall magnitude of the heart's electrical potential is then measured from 12 different angles while using the electrode. It is a graph of the voltage versus time of the electrical activity of the heart. So this is the electrocardiogram in which showing different waves. So this is the P waves and this one a QRS wave and then S waves and this is the T waves. So different waves have different significance. So we will study about this. Like the graph of the voltage versus time produced is an electrocardiogram. So the P waves which represent the depolarization of the atria or auricle, while the QRS complex represent depolarization of the ventricles. T waves which represent the repolarization of the ventricles. So there are the three main components of the ECG. P is the atrial systole contraction pulse. Q is the downward deflection immediately preceding the ventricle contraction. R is the peak of the ventricle contraction, while S is the downward deflection immediately after the ventricular contraction. T is the refractory recovery of the ventricle. So these are different, the significance and voltage time graph, different waves are showing of the depolarization or repolarization of the activity of the heart. So this is the overall ECG. So you can see here this is a P waves and QRS while it is a T waves. So this pattern is repeated again and again. So in this way it is called electrocardiogram. So what do you mean by this graph or what they are representing? If we do the analysis of the electrocardiogram, we can see here this is the time graph x-axis and amplitude on the y-axis. So 1 square is represented 1 millivolt. That means it is 10 millimeter height reference pulse. So if we can measure over here a small box of 1 into 1 millimeter and represent 0.1 millivolt into 0.054 seconds. So this the time of the 1 square is 0.04 second and this amplitude of the 1 square is 0.1 millivolt. So a graph, if we consider the 5 millimeter into the 5 millimeter represent 0.5 millivolt into 20 seconds. So a large box is represented by heavier line weight in the small box. So in this way, suppose if we have to measure of the potential of this graph, so we can count the number of the square here and this square. So we can multiply about all over and we can find how much voltage is created in all over the amplitude. So here it is represented by the 1 square, one small 1 millimeter into 1 millimeter block. So represent 40 millisecond time and 0.1 millivolt amplitude. While here one large 5 millimeter into 5 millimeter box, it represents 0.2 seconds and 200 milliseconds time and 0.5 millivolt amplitude. So now come to the topic heart arrhythmia. Heart arrhythmia is a condition in which heartbeat is irregular. Either it can be too slow or it can be too fast. In the adults, normal heart rate is between 60 to 100 beats per minute, and it is higher in the children and small birds and small animals. A heart rate less than normal is called bradycardia. So in the adult condition, the bradycardia, if the heartbeat less than 60, while if it is greater than 100, then it is called tachycardia. So the ECG shows the pattern having a heart attack. So you can see here, this is a heart attack pattern where the ST elevation occur. So this is normal here, but in this graph you can see here is abnormal structure, and the QRS wave is abnormal because S is not going to downward while it is just in the upward direction. So it is a ST elevation. So you can see in the clear graph, if we take one section of the myocardial infarction or heart attack, so this is the P and the QRS, and this S wave is not going to the downward direction, and it is just on the, it goes upward direction. So it is called ST elevation. So it is also here, this is ST elevation. So ST elevation occur in the heart attack or myocardial infarction. So by observing this graph, we can understand either it is heart attack or normal graph of ECG. So in the process of recording of ECG, the 10 electrode and in the 12 lead ECG is required, which is shown here. There are different electrode and leads. They are placed at the different position, and when we measuring the ECG. So this is the figure where we have shown the different of electrode applying on the skins. So these are different positions, V1, V2, V3, V4. Like this is position where the different electrode is placed, and these electrode are like this. This is a lead that will attach to the particular surface and record the ECG. And it is the very old ECG which was early discovered, and now it is totally different. It has totally changed at that time. So this is the references. Thank you.